At present, the cumulative number of COVID-19 infections in the world has exceeded more than 16 million. I hesitated for a long time and decided to stand up and tell the world, I have a way to solve the crisis of COVID-19. I am very confident in its effectiveness. The reason why I hesitate is because my method will be ridiculed by many people, and it may be difficult to obtain the approval of doctors and experts. What is my method? Acupoint tuina. And I think that only one acupuncture point is enough to solve the crisis of COVID-19. As long as you need this acupuncture point at the first time of symptoms, your symptoms will all disappear. You will find that COVID-19 is not terrible at all. At present, the fear of it in the world is unnecessary. As long as the tuina method I mentioned is popularized, no one will die from COVID-19. I know that all doctors and experts believe that only drugs can stop COVID-19. But traditional Chinese medicine has a point of view since ancient times. Many acupoints in our body are equivalent to a medicine. We should also think of acupoints as medicine, and it is a medicine that does not cost money. The most important thing is that it can also be used as a preventive method. Our world's approach to COVID-19 is to stop its spread. This method consumes a lot of social resources and has a great impact on the economy. I think we need to adjust our thinking. We can control the symptoms and harm of COVID-19 to the extent that it will not cause death. My tuina method can completely eliminate the symptoms after infection, and no infected person will die. Although the virus may still be in the body, it is like carrying a cold virus to us, which does not affect our life and work. The cost of this method is very small. We can popularize 1 or 2 acupoints. Now I will start to introduce my tuina method. I want to introduce a magical acupoint that can help us solve the cold, flu and COVID-19. Which acupoint? This acupoint is called Yiwofeng. I named it warm army in English. Where is the acupoint? It's on the back of your wrist. Stick out your left hand. The back of your hand is upward. There is a wrinkle on the back of your hand, and there is a big concave hole in the middle position. When your hand bends up and down, you can obviously feel the existence of this acupoint. This acupoint is called Yiwofeng. This acupoint is warm and specialized in treating cold disease. It's like a patrol force. As long as the cold destroyer comes, you start it. It can quickly rush to eliminate the cold. The way to activate the acupoint is simple. Use the thumb of your right hand to move it around the center of the acupoint. The cold and flu are the most typical cold disease at the early stage of symptoms, and the early symptoms of COVID-19 mainly come from cold disease. I must tell everyone, the effect of this acupoint in the treatment of cold and flu is magical. For common cold, as long as you need this acupoint at the first time of cold symptoms, the cold symptoms will disappear in 5 to 10 minutes. If you use it when the cold symptoms are still very mild, it only takes 3 minutes at the fastest. If it is a flu symptom, it may take about 30 minutes to get rid of the symptoms, probably due to the long incubation period. When I say it's magical, maybe all doctors and experts will say it's impossible, because there is currently no way for colds in medicine. The so-called cold medicine is to relieve symptoms instead of real treatment, and the way to deal with influenza is antiviral drugs and vaccines. I can assure everyone that in 3 or 5 years, few people on Earth will take cold medicine, and the antiviral drugs and vaccines for influenza will gradually disappear from the Earth, because this acupoint is the natural enemy of cold and flu. Kneading this acupoint for 10 minutes or 30 minutes can make the cold symptoms disappear. Do you still need to take medicine? But there is a window period for the use of this acupoint. The earlier you use it, the better from the moment you have symptoms of a cold. Kneading this acupoint at the first time of symptoms has the best effect. After 1 day, the effect is usually reduced by half, and it may be invalid after 2 or 3 days. And it only applies to cold disease stage. If you have fever symptoms, kneading acupoints on the first day of fever is often effective. On the second day, the cold in your body is transforming into heat. The effect is often not very good, and it may fail on the 3rd day. So I especially emphasize, please try to use it at the first time of symptoms, whether your symptoms are cough, fever, runny nose, or sore throat, they can quickly disappear. Let's take a look at COVID-19. What's the difference between COVID-19 and cold flu? Chinese traditional medicine experts have made an analysis. COVID-19 has two attributes, cold and wet. In other words, COVID-19 can be seen as a combination of influenza and damp disease. Damp disease is characterized by stickiness, slow, a bit like brown sugar. It is difficult to get rid of immediately after being stained. So, COVID-19 is not easy to cure quickly than influenza. And the combination of influenza and damp disease makes severe patients have the risk of death. In the later stage of severe patients, the mucus in the lungs becomes heavier and heavier, and the probability of death is very high. There is a problem here: severe patients may die in the later stage. Is there any way to prevent each infected person from entering the critical stage? I definitely say, yes. The method is the Yiwofeng Acupoint I just mentioned. The method is very simple: knead the Yiwofeng Acupoint at the first time of symptoms, and then all symptoms will be eliminated in 40 minutes. Then the infected person will become an asymptomatic patient, and will not enter the severe stage. No one will die of COVID-19. Why become an asymptomatic patient? Because the symptoms of COVID-19 mainly come from cold disease, and the symptoms are very similar to cold and flu. If the cold disease has been eliminated and only damp disease is left, then the infected person will become a symptomatic infected person. Some people may ask, can Yiwofeng Acupoint cure dampness? With this question, I checked the information for a long time, and the final answer surprised me. This acupoint can not only expel cold, but also dispel dampness. The basis for its ability to dispel dampness is clearly mentioned in books such as Jinkui of traditional Chinese medicine. Using the method of relieving sweating, if it can be controlled to sweat slightly, it will have the effect of dispelling dampness. If you sweat a lot at once, you can't get rid of dampness. The Yiwofeng is the acupoint for relieving sweating. Kneading for 30 or 40 minutes can make you sweat slightly and slowly. It can dispel dampness. If we pay attention to the world's active athletes, we will find that they are almost asymptomatic patients after infection, and the speed of improvement is very fast. I think the most important reason is that they keep training and often have a slight sweating, which can just dispel dampness. I would also like to put forward a concept of absorption period. This is a judgment I got from studying many COVID-19 cases. If you eliminate the cold in your body and the dampness has not been removed, you will easily be infected again if you encounter other infected persons. This is because the virus lost the attribute of cold, called for cold, has a strong desire to absorb it. I expect the absorption period may last 2 weeks, during which you may be infected a second or third time. But no matter how many times you come, you can use Yiwofeng Acupoint to make the symptoms disappear quickly. In other words, using tuina method, COVID-19 can be seen as a more tenacious flu. You kill it once, and it may come again in 2 weeks. But no matter how many times you come, you can use tuina to kill it. So, it's not terrible. With tuina, no one will die of COVID-19, you just become an asymptomatic infector. To sum up, my tuina treatment of COVID-19 is, knead for about 40 minutes at the first time of similar cold symptoms, until you have a slight sweating. Your symptoms will definitely disappear. Note, if it is a child, there will be slight sweating in more than 10 minutes, and it can be stopped. This step is mainly to expel the cold. In the next few days, keep moderate exercise to make yourself slightly sweating, or use Yiwofeng Acupoint to make yourself slightly sweating. This step is to dispel dampness. This is the fastest and best treatment. And you don't need to spend a penny, nor do you need to isolate or block. Another advantage of this method is that there are no side effects and is especially suitable for pregnant women. On the basis of this basic scheme, I would like to add 2 schemes. Treatment Scheme A is applicable to early infected patients with diarrhea symptoms. Diarrhea means that cold has crossed the lungs and reached the digestive tract system. Strictly speaking, it is not the first time for symptoms. However, Yiwofeng Acupoint is still effective, and it only needs to add an additional acupoint to treat diarrhea. This acupoint is called banmen. This acupoint is located under the thumb of the hand, in the middle of the palm muscle, a small oval area. The method is also kneading. It can quickly stop vomiting and diarrhea. How long you knead it depends on the strength of your kneading. The greater the strength, the faster the effect will be. Especially there is a point in the middle of the small area. When you knead it, you will feel a little slight pain. The point where you feel the pain is also the best position. Kneading this point may take 10 to 20 minutes to stop vomiting and diarrhea. Sometimes it takes 50 minutes or 1 hour. It is recommended to knead for more than 20 minutes. If the early symptoms of COVID-19 infection have diarrhea, the use of banmen acupoint can quickly cure diarrhea, and then use Yiwofeng acupoint to quickly eliminate symptoms similar to cold. I would like to add another treatment plan B. It is suitable for infected people who have high fever symptoms in the early stage. The high fever indicates that the lungs have been inflamed. I suggest adding tuina techniques to eliminate pneumonia in addition to Yiwofeng acupoint. At this time, you need to prepare a box of talcum powder for tuina. Use 2 acupoints to eliminate pneumonia. The first acupoint is king fei. The ring finger is pushed from the root of the finger to the fingertip for 30 minutes. When pushing, you need to rub some talcum powder properly. The second acupuncture point is called knead. Take the palm of the left hand as the center, and draw a circle about 2/3 outward, which is called bagua. First rub some talcum powder and push it with the thumb of your right hand in a circular way. This is called knead. Push left hand flat, push for about 30 minutes. These 2 acupuncture points are used in combination to relieve cough and eliminate pneumonia. That is to say, if you have symptoms of high fever, then it is recommended to use these 3 acupoints, Yiwofeng, king fei and knead. In addition, if you miss the first time of symptoms, as long as within 1 week, it is recommended to use this option B. Because they are the acupoints of Chinese children tuina, only a few Chinese know about them, and people think that they can only treat children, not suitable for adults. I may be the only one who has changed them into self-healing techniques to treat myself. In the process of self-treatment, I found that the effect of using Yiwofeng acupoint at the first time of symptoms is the most magical, and it only takes a few minutes to make the symptoms disappear. This is not recorded in any book, and I found it occasionally. This is a small discovery, but its value is huge. Because of this small discovery, I am very determined to tell the world, as long as you need the Yiwofeng acupoint for 40 minutes at the first time of symptoms, and knead until you are slightly sweating, whether you are flu or COVID-19, the symptoms will disappear completely, and you will not be in danger of death. If everyone understands this, we can get rid of the trouble of COVID-19. I know that many people are looking forward to the COVID-19 vaccine, but according to the current information, the protection period provided by the vaccine may be only a few weeks or months. Then a question arises: we need to get vaccinated at regular intervals. Can it cover every corner of the world? The tuina method I mentioned may be the best way to solve COVID-19 in our planet, and it may even be better than the vaccine. If the efficacy of Yiwofeng in the treatment of COVID-19 is verified, I think many countries do not need vaccines. If I need this acupoint for 30 or 40 minutes and the symptoms disappear completely, do I still need to get vaccinated?